So today we'll begin a simple primary care review on delirium. American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, 5th edition, lists 5 key features that characterize delirium: disturbance in attention and awareness. The disturbance develops over a short period of time, represents a change from baseline, and tends to fluctuate during the day. An additional disturbance in cognition, memory deficit, disorientation, language, visual spatial ability, or perception. The disturbances are not better explained by another pre existing, evolving, or established neurocognitive disorder and do not occur in the context of a severely reduced level of arousal, such as a coma. There is evidence from the history, physical examination, or laboratory findings that the disturbance is caused by a medical condition, substance intoxication or withdrawal, or medication side effects. Risk factors: brain diseases such as dementia, stroke, or Parkinson's disease. Precipitating factors: this includes polypharmacy, particularly psychoactive drugs, infection, dehydration, immobility, malnutrition, or the use of bladder catheters. Clinical presentations: a disturbance of consciousness and altered cognition are essential components. The condition typically develops over a short period of time and tends to fluctuate during the day. Others include psychomotor agitation, sleep wake reversals, irritability, anxiety, emotional lability, and hypersensitivity to lights and sounds. Disturbance of consciousness: it is a change in the level of awareness and the ability to focus, sustain, or shift attention. Family members or caregivers usually report that the patient isn't acting quite right. Change in cognition: this includes memory loss, disorientation, and difficulty with language and speech. Mental status testing can be used to document the degree of impairment. Neurologic examination: the level of consciousness, degree of attention or inattention, visual fields and unambiguous cranial nerve, motor deficits is important to identify individuals with a higher likelihood of focal neurologic disease. Instrument: the Confusion Assessment Method, CAM, is a tool that can be used for observation and probable diagnosis. The CAM has become a standard screening device in clinical studies of delirium. Management: treat the underlying conditions: dehydration, hyponatremia, hypernatremia, hypo or hypercalcemia, infections, organ failure, hypoglycemia, drug toxicity, or withdrawal from alcohol and sedatives. On pharmacologic management of agitated patients includes mild confusion and agitation, may respond to interpersonal and environmental manipulations, frequent reassurance, touch, and verbal orientation can lessen disruptive behaviors. Family members or other familiar persons are preferred. Professional sitters can also be used to affect. Antipsychotic medications. Antipsychotic agents are generally used to treat severe agitation in the patient with delirium. Based on limited evidence, a low dose of haloperidol 0.5 to 1 milligrams has been used as needed to control moderate to severe agitation or psychotic symptoms, and up to a maximum dose of 5 milligrams per day. Thank you.